sent to you. We will have a special update from a WHO Scientific Advisory Group for the Origins of Novel Pathogen, or SAGO. We will have with us the chair of SAGO, and Dr. Tedros will introduce her in a minute. I will now introduce our guests here, our speakers, who will be answering your questions. Obviously, with us is Dr. Tedros Adhanom Ghebreyesus, WHO Director General. With us is also Dr. Mike Ryan, Executive Director of WHO Health Emergencies Program and Deputy Director General. Dr. Maria Van Kerkhove is the Director ad interim of Epidemic and Pandemic Threat Management. We have also with us Mr. Nabil Tabal, who is Incident Manager within WHO Health Emergency Program. Dr. Kate O'Brien is our Director for Immunization, Vaccines and Biologicals. We also have Dr. Teresa Zaccaria, who is the Unit Head of Humanitarian and Disaster Action. We may also have some other WHO experts and speakers, if need be, to answer some of your questions. With this, I will give the floor to Dr. Tedros for his opening remarks.
Thank you, Tariq. Good morning, good afternoon, and good evening. Today, WHO is publishing the report of the Scientific Advisory Group for the Origins of Novel Pathogens, or SAGO, on the origins of COVID-19. We're honored to be joined today by SAGO's chair, Dr. Marieke Venter, who will present SAGO's findings in a few minutes. But first, some updates on other health issues around the world. WHO welcomes the ceasefire agreed between Israel and the Islamic Republic of Iran, and we hope it holds. Iran has reported more than 600 deaths and 5,000 injuries, and Israel has reported 28 deaths and more than 3,200 injuries. Between the 13th and 25th of June, WHO has documented 9 attacks on health in Israel and 5 attacks in Iran, impacting health services and causing deaths and injuries among health workers and patients. WHO will continue to work with Israel and Iran, including monitoring radiological and nuclear risks. This week, WHO participated in nuclear emergency exercise organized by the International Atomic Energy Agency to test emergency preparedness and response capacities and identify areas in need of improvement. Meanwhile, in Gaza, the situation is beyond catastrophic. Only 17 hospitals are functioning even partially out of 36 across the Strip, with no hospitals operating in the north of Gaza or Rafah. In the last 2 weeks, 500 people have been killed while seeking food aid at 9 UN militarized food distribution sites and routes, resulting in a surge in injuries and taking a severe toll on hospitals in Gaza City as fuel, water, and medical supplies are depleting fast. Meanwhile, hunger stalks everyone, making them weaker, sicker, and more vulnerable. Since the start of this year, an average of 112 children have been admitted every day for treatment of acute malnutrition. In recent days, WHO managed to retrieve fuel supplies from our warehouses to support hospitals. Over the past few months, WHO has supplied over 1.7 million liters of fuel to health facilities, ambulance service providers, and partners. This week, WHO delivered medical supplies for the first time since the 2nd of March, with 9 trucks carrying essential medical supplies, including blood units. These supplies will be distributed to priority hospitals in the coming days, and more are en route. But it's only a drop in the ocean given the immense health needs. Since the conflict began, WHO has supported the evacuation of more than 7,300 patients from Gaza Strip, But since Israel's blockade began on the 18th of March, we have only been permitted to evacuate 294 patients, a tiny proportion of the more than 10,000 people who still need medical evacuation. WHO thanks Italy, Jordan, Saudi Arabia, the United Arab Emirates, and the United States for receiving evacuated patients. WHO calls for access for food, water, fuel, medical, and other aid at scale through all possible routes. Now to Sudan, the forgotten crisis. The ongoing civil war means people are dying from a lack of access to health services and medicines. Ongoing fighting has displaced more people than in any other crisis in the world. Health facilities are either out of service or only providing limited care. And diseases are spreading fast. Cholera has spread to all but one state of Sudan, with a worrying spike in Khartoum state. With WHO support, the Ministry of Health completed a 10-day cholera vaccination campaign that reached more than 2 million people in Khartoum state, and we're already seeing signs of improvement. WHO and partners are stepping up the response in other states and exploring options to strengthen the response in the inaccessible states of Darfur and Kordofan through delivery of critical cholera supplies, vaccines, and medicines. Just last week, the Al-Mujlad hospital in West Kordofan was attacked and 40 civilians, including children and health workers, were killed. I urge the world, do not forget the people of Sudan. Humanitarians and civilians must be protected at all times. We need urgent funding and we need access to make sure people receive the health care they need. And above all, the people of Sudan need peace. On Wednesday this week, I was in Brussels for the replenishment of the Gavi Alliance. Vaccines are among the most powerful innovations in history. In 1974, WHO founded the Expanded Program on Immunization, EPI, to harness the power of vaccines for the world. Since then, EPI has helped to save about 154 million lives. Since 2000, under-5 mortality has dropped by more than half globally, thanks largely to the power of vaccines and the work of Gavi. So I was very encouraged that donors pledged more than $9 billion to support Gavi's work over the next 5 years. In addition, Gavi implementing countries are investing a record $4 billion in their national immunization programs over the next 5 years. This is very positive news at a difficult time in global health, with drastic cuts in aid and mis- and disinformation about vaccine safety. Protecting children from life-threatening diseases takes more than just vaccines. It takes trust. It's important that parents, educators, health workers, and community leaders understand vaccine information clearly. When people know the facts, they can make better, more confident decisions. False claims and the distortion of scientific evidence are dangerous. For WHO, vaccine safety is central to our decision-making. WHO looks forward to its continuing partnership with Gavi to build on our success and reach more children with more vaccines faster than ever before. Now, returning to our main subject today, the SEGO report on the origins of COVID-19. The COVID-19 pandemic was the most severe health emergency in a century. It left an estimated 20 million people dead, wiped at least $10 trillion from the global economy, and caused enormous social and political upheaval. And we cannot talk about COVID-19 in the past tense. Although the crisis has passed, the virus remains. It continues to evolve, continues to kill, and millions of people continue to live with post-COVID condition or long COVID. The pandemic taught the world many painful lessons, and over the past 5 years, WHO, our partners, and many countries have put in place many initiatives in response to those lessons. We established the WHO Hub for Epidemic and Pandemic Intelligence in Germany, the mRNA Technology Transfer Program in South Africa to boost manufacturing in the South, the Global Manufacturing Training Hub in the Republic of Korea, the BioHub here in Switzerland, the Interim Medical Countermeasures Network, the Global Health Emergency Corps. Together with the World Bank, we established the Pandemic Fund and more. As you know, at the World Health Assembly last year, WHO member states adopted a package of amendments to the international health regulations, and last month, after 3.5 years of intense negotiations, they adopted the WHO Pandemic Agreement, a landmark instrument of international law to make the world safer from pandemics. Over the past 5 years, we have learned a lot about COVID-19, but there is one crucial question about the pandemic that we have not yet answered: how it started. Understanding how any outbreak, epidemic, or pandemic starts is essential for preventing future outbreaks. It's also a moral imperative for the sake of those who lose their lives to them. In late 2020, the World Health Assembly gave WHO the task of studying the origins of COVID-19. In 2021, I established the Scientific Advisory Group for the Origins of Novel Pathogens, or SEGO, an international multidisciplinary panel of 27 independent experts. SEGO was established with two core mandates. First, to develop a framework for the types of studies that should be performed to understand the source of emerging and re-emerging pathogens with epidemic or pandemic potential. SEGO completed this first part of its work last year. The second part of its mandate was to take forward the study of the origins of COVID-19, which it has been doing in parallel with the first part of its mandate over the past 4 years. Today, WHO is publishing SEGO's report, and I would like to invite SEGO's chair, Dr. Marieke Venter, to present the findings. Dr. Venter is Distinguished Professor and Research Chair for One Health, Surveillance and Vaccines at the University of Witwatersrand in Johannesburg, South Africa. Sorry about the name, but I think you will understand. Witwatersrand. Marieke, you have the floor.
Thank you, Dr. Tedros. Good afternoon, good morning, good evening, ladies and gentlemen. So I would like to tell you about the SEGO independent assessment on the origins of SARS-CoV-2. So our focus is really the science, so I would like to tell you what the science says. So the SEGO is an independent assessment and deliberations on the origins of SARS-CoV-2 is primarily based on published scientific reports and build on the WHO-China joint March 2021 and SEGO 2022 reports. We also evaluated available intelligence reports and invited presentations by scientists from China, as well as international scientists and experts discussions during closed meetings between November 2021 and June 2025 to clarify critical unknowns. Not all the information requested has, however, been shared or investigated at this stage. SEGO evaluated the currently available scientific evidence that may support or dismiss the current major hypotheses on the origins of SARS-CoV-2. So these include, firstly, Hypothesis 1 on a zoonotic transmission from animals, either directly from bats or through an intermediate animal host to humans. Most scientific data and accessible published scientific evidence currently support this hypothesis. However, SAGO is not currently able to conclude exactly when, where, and how SARS-CoV-2 first entered the human population. The closest known precursor strains were identified in bats in China in 2013 and in Laos in 2020. However, these strains are too distantly related to SARS-CoV-2 to be the direct source of the COVID-19 pandemic. The Wuhan seafood market in Wuhan, China, played a significant role in the early transmission and amplification of the virus, with 60% of early cases in December 2019 that could be traced to the market or lived in close proximity to the market with a risk of exposure to visitors or animal products from the market. No evidence exists of widespread human or animal cases prior to December 2019 anywhere else. So 2 lineages were identified at the market, which support prior evolution in animals or in humans rather than a single source. The metagenomic evidence identified several species of wildlife that were present in the market that can be considered as potential intermediate hosts and that may have infected early human cases. Comprehensive upstream investigations at the source of wildlife species trade at this market and other markets in and around Wuhan is, however, still lacking. It is therefore not yet clear if the Wuhan seafood market was where the virus first spilled over into humans or if it occurred through upstream infected human or animals at the market. The second hypothesis that look at an accidental laboratory-related event, either during field investigations or a breach in lab biosafety and biosecurity. Much of the information needed to assess this hypothesis has not been made available to WHO and SAGO, despite repeat requests to the government of China, and therefore this hypothesis could not be investigated or excluded. Data provided in intelligence reports was also assessed, but was tend to be very speculative, based on political opinions and not backed up by science. SAGO and WHO have requested further information from member states, including the government of China, Germany, and the United States of America, on an unpublished report that has been reported in the press. However, at the time of writing, the required information had not been provided to WHO. The third hypothesis that looks at introduction of SARS-CoV-2 into animal markets via cold chain processes and subsequent infection of humans through contact with products sold at the market was evaluated in the WHO China March 21 and SAGO 2022 reports. No additional evidence to support this hypothesis has become available to suggest that the transmission of SARS-CoV-2 to humans from frozen products at the Wuhan seafood market occurred or at any other market at the start of the pandemic in Wuhan. More data is required to prove this hypothesis. Hypothesis 4, to look at the deliberate manipulation of the virus in the lab and subsequent biosafety breach. SAGO analyzed the genome structure of the virus and any related publications and reports, but did not find scientific evidence supporting this hypothesis. There's also evidence that these mutations and recombination events occur in coronaviruses in nature. This hypothesis is also remains largely unsupported by either scientific and intelligence reports. SAGO will reevaluate these hypotheses should additional scientific evidence become available. But to conclude, while a zoonotic origin with the spillover from animals to humans is currently considered the best supported hypothesis by the available scientific data, until further requests for information are met or more scientific data becomes available, the origins of SARS-CoV-2 and how it entered the human population will remain inconclusive. Thank you very much.
Thank you, Dr. Venter, and thank you so much for your leadership of SAGO over the past 4 years. We recognize that this has been a very difficult task on a very complex and often contentious issues. I also thank each of the 27 members of SAGO for dedicating their time and expertise to this very important scientific undertaking. We know that SAGO's members have not agreed on every point, and that's to be expected. Earlier this week, one member of SEGO resigned, and 3 other members asked for their names to be removed from the report. SEGO has advanced our understanding of the origins of COVID-19, but much of the information needed to evaluate fully all hypotheses has not been provided. WHO recognized that China has shared some of this information, but not everything that we have requested. Despite our repeated requests, China hasn't provided hundreds of viral sequences from individuals with COVID-19 early in the pandemic. More detailed information on animals sold at markets in Wuhan, and information on work done and biosafety conditions at laboratories in Wuhan. WHO is also aware of intelligence reports performed by other governments around the world on the origins of COVID-19. We have also requested access to those reports. Neither WHO nor SEGO has yet had access to these reports or their underlying data. As things stand, all hypotheses must remain on the table, including zoonotic spillover and lab leak. We continue to appeal to China and any other country that has information about the origins of COVID-19 to share that information openly in the interests of protecting the world from future pandemics. WHO and SEGO remain ready to evaluate any further information that comes to light, and we remain committed to continuing and concluding this vital scientific undertaking. Tariq, back to you.
Thank you very much, Dr. Tedros, and thanks to Dr. Venter as well. So the SEGO report will be published on our website immediately at the end of this press conference. Also, a press release that will contain the link to the report will be sent to our global media list, and in case you don't receive it, don't hesitate to contact us. So now we will open the floor to questions. Please click the icon raise hand if you have questions and clearly identify yourself. We will start with Nina Larsson from Agence France Presse. Nina, please go ahead.
Yeah, hi. My question, I appreciate the briefing. I had a quick just a quick question on the SEGO stuff, and I had another question. So I hope you'll bear with me. I was hoping that you could tell me, if you are continuing with the work on if SEGO will be continuing, because that was a little bit unclear from what was being said. And then the question I wanted to ask was about vaccines. I wanted to ask how concerned the WHO is about the decision by U.S. Health Secretary Robert Kennedy Jr.'s newly appointed advisory committee on immunization practices and its decision to oppose the use of thimerosal as a preservative in flu vaccines. Because I'm wondering if you think this preservative actually presents a risk, or how that risk might compare to the risk of influenza, and what you think this might do to vaccine confidence worldwide. Thank you.
Thank you very much, Nina. I think for the first question, we will go to Dr. Maria van Kerkhove, and then after that, Dr. Kate O'Brien may answer the second one.
Thanks very much, Tariq, and thanks, Nina, for the question. So first, I just want to reiterate the thanks to the 27 members of SEGO who thoughtfully and robustly debated the origins of COVID-19 over the last 3.5 years. It was an incredibly challenging task, as Dr. Tedros and both Mariki have stated. This group of SEGO are members. These are independent experts who answered a call to join an advisory group. Normally, advisory group members have a lifespan of about 2 years, but we actually extended their membership so that they could finish the 2 major core tasks that were given to them. One was to do the global framework, which they published last year, and second was to provide an independent assessment of COVID-19, which we are publishing today. So the plan will be that once this publication comes out, which you will see shortly after this press conference, we're thanking all of the members for the incredible work that they've done and the significant amount of time that they have provided to WHO to provide this advice and to provide this work. We plan to issue another open call for experts for SAGO, and that will be launched in July 2025. But this is part of the normal process of WHO advisory groups. This is nothing different from SAGO versus other advisory groups. But to really answer your question, the work to understand the origins of COVID-19 is unfinished. There's more work that needs to be done. We at WHO recognize a significant amount of research that has been conducted in China and globally by incredible scientists from around the world, but we need more to be able to rule hypotheses in and rule hypotheses out. So the work does remain unfinished. And as Dr. Tedros has said, and as Mariki has said, it's not just a technical exercise. There is a moral imperative here to really understand, because we need to do much better, be much more precise at preventing epidemics and outbreaks into the future.
Thanks so much about the question regarding thimerosal. So thimerosal has been reviewed multiple times by multiple agencies, including WHO, and it's clear from the evidence that there is no evidence of harm from the use of thimerosal. Thimerosal is an important ingredient in some of the vaccines where we're using multi-dose vials, and it is preventing and reducing the risk of contamination of that vial after multiple punctures in the vial to draw up doses from a vial to immunize different children. So for some of the vaccine supply, this is a very important ingredient in order to assure that we have the doses that are needed to protect children from serious and life-threatening diseases. An effort has been made, an extensive effort has been made to remove thimerosal out of an abundance of caution from the vaccine supply. But again, I want to emphasize that the evidence does not indicate that there's a risk of thimerosal, even for those vaccines where there is continuous need to have vials that have multiple doses in them, and that this is the preservative. So the big question is really just assuring that the public understands that there has been a thorough review of the evidence around the safety of thimerosal, and that we continue to need vaccines that some of them have thimerosal in them, but certainly everything has been done to reduce any potential risk, which has not been demonstrated to exist. For the US, the vaccine supply is really a question for the US to address, and whether or not they need to continue to have vials that have multiple doses in the vial. But I just want to emphasize the importance of safety reviews and safety evidence. It's the top priority for all vaccines, and this evidence has been reviewed thoroughly. Thank you.
Thank you, Dr. Van Kerkhove and Dr. O'Brien. Next question, Helen Branswell from STAT. Helen?
Thank you very much, Tarek, and doing this briefing. I understand why the world wants to know the source of the COVID-19 pandemic. I don't actually think at this point that anyone's ever going to be persuaded one way or another by new evidence, but be that as it may, is WHO concerned that this issue has become such a political football that people are tossing it around and using it as a weapon against each other, instead of doing the work that needs to be done to make sure that spillovers, if they occur, are caught quickly and extinguished, and that lab leaks or the risk of lab leaks is diminished by better lab safety protocols? I mean, it feels like everybody's so concerned about what the origin is as opposed to trying to stop the next one. Is that a concern for WHO? Thank you.
Thank you, Helen. That's a very good question. Well, we start with Dr. Van Kerkhove.
Yeah, thanks, Helen, very much for the question. Of course, we're concerned about the politicization of any scientific topic, any public health topic, certainly one that has caused at least 20 million deaths worldwide and is still circulating. The Director General established the advisory group, this SAGO, to bring the conversation back to science. This is what this group has attempted to do over the last 3.5 years. This is what this group, and Mariki can comment on this, about the discussions that they had, and how robust those were. In terms of bringing it back to what do we actually know? What does the data tell us? What does the science say? And what you will see in the report literally what does the science say? And it also highlights what we're missing. And so what we've attempted to do, always here at WHO, but through the SAGO as well, is to bring the conversation back to the science. Because yes, you are correct, there is a lot of politicization of this. There's a lot of moving back and forth, and it's distracting the discussion, as you say, from the real work that needs to get done. Is the world safer now for the next pandemic? Are we ready for the next pandemic? And you've heard the DG say many times, yes and no. So many more capacities exist now, but this politicization of what's happened, certainly with COVID, doesn't make the world safer. And this is why it's so critical that governments continue to invest in surveillance, comprehensive surveillance, not just in humans, but smart surveillance in humans, in animals, at the animal-human interface, that those detection methods are really robust for the threats that we know exist, but also the ones that might be there because of environmental suitability or where animals are moving or trade patterns or sale patterns. And I can go on and on. You mentioned laboratory biosafety and biosecurity. There's a lot of expanded capacity for laboratories for detection methods. This expansion started before COVID and it was accelerated over the last 5 years. We have a laboratory biosafety and biosecurity manual. We have to make sure that that is implemented. It should not be taken for granted that labs that are working with pathogens are always doing those under the safest conditions. This is why we work so closely with member states to make sure that the governance is in place, that these labs are evaluated, that the research is evaluated to be done under the safest conditions possible, because we do know lab leaks can happen. They've happened in the past, they will happen in the future. So I share your concern that we're not having the right conversation. However, I'm very grateful for these 27 scientists. I'm very grateful for all of the scientists that have really put their efforts, the governments that have supported the research to be able to understand this, because it isn't a simple answer. We need to be much more precise. It's not just zoonotic or lab leak. It's what were those exact conditions that took place for this pandemic to begin. It's not about blame. It's about actually getting much more precise about preventing the next one. So that's what we are focused here on, and extremely grateful for the 27 members of SAGO who helped us to achieve the report that you will see later today.
Thank you, Dr. Van Kerkhove. So we will go to Tianyu San, who is with the Guangming Daily. So San, if you can unmute yourself and please ask your question.
Yes, can you hear me?
Yes, very well.
Yeah. The first, thank you for organizing this press conference. If I understand correctly, will the SAGO group be disbanded after today? And the next question is, what specific scientific progress has SAGO made so far in investigating the origins of emerging pathogens? Are there any new leads or hypotheses currently being prioritized for research? And the next question, does SAGO have any new plans to conduct on-site investigations into the origins of COVID-19 in the future? If so, which countries or regions are considered potential targets for such investigations? And thank you very much. And and the new SAGO group will have any new responsibilities later? Thank you.
Thank you, San, for those questions. They're very good. So maybe we can start with Dr. Van Kerkhove, and I'm sure Dr. Venter would like to add as well. But maybe Dr. Van Kerkhove, would you like?
I'll cover the first and the last part of that, and then it would be great if, Mariki, you could cover the question related to the advances that SAGO has made and the leads that they've made. So just to say, you asked the question of, is SAGO going to be suspended? That's not quite the right term. So this is an advisory group, and per our normal processes, there's membership is about 2 years, as I said before. This group has actually been extended to about 3.5 years, almost 4 years now. So they've reached the end of their term, and this is the natural plan for this. We will have another open call, which will have new terms of reference, because this SAGO group, the members of this particular SAGO group, actually finished the work. So this is part of the normal procedures. And again, I want to thank all the members of SAGO for staying on longer than the 2 years. So we'll let you know when the new terms of reference, the new call for members will be up there. In terms of the on-site investigations, I just want to highlight 2 things, and I think, Mariki, you should cover this as well. In the SAGO 2022 report, where they published their preliminary findings, there were a number of studies that were recommended in China, but also globally, to follow up some of the missions that had taken place in China. So there's more work to be done globally. However, we really need to focus additional and further information from China, because this is where the first cases were reported. So there are a number of studies that have been recommended. We've articulated those a number of times. We can point to the report where they're all listed, but there are a number of investigations that relate to animal studies, relate to studies of humans that were working with animals in different markets, related to some of the early potential cases in China. We've done some follow-up studies in Italy and in other countries to look at wherever a sample tested positive, let's say in December 2019 or November 2019, to follow up and confirm or not confirm those results. So this is a global search, but it really is important to make sure that the comprehensive studies that need to be done in China, where those first cases were reported, are conducted. And again, thanking the work that's already been done, but more work needs to be done. Maybe over to Mariki.
Dr. Venter, please go ahead.
Okay. Yeah, thank you very much for the question. So one of the outputs of SAGO was actually to develop a global framework that is specifically aimed at investigating the origins of novel pathogens. So we use the basis of this framework to do the independent assessment study on COVID. So it's not the only virus that we look at, but it was the one that it was most widely applied to now initially. So it really focused at early investigations, at human studies, so human epidemiology, at animal-human interface studies, at environmental studies, at genomic studies, and at biosafety and biosecurity studies as well. We have made or released statements on Mpox last year as well, when it occurred the first time, and made recommendations on that. And SAGO will continue to do that. So as new pathogens occur, they will make recommendations and also be involved in investigation of the origins of those pathogens. So it's been an honor serving as the SAGO chair. And I also want to reiterate, the scientists that were involved were all international experts, and there were enormous input from everybody. So this group is not being let go, as Maria say. We are basically at the end of an extended term already. Many people may apply to carry on, but there will probably also be new members. Thank you.
Thank you very much, Dr. Venter and Dr. Van Kerkhove. So next question, John Cohen from Science. John, please. Do we have a John Cohen? John, could you please unmute yourself?
Can you tell us the name of the scientist who resigned? And 3 signed.
John,
you can't
John, we didn't hear the beginning of your question. Can you start again, please?
Yeah, can you hear me now?
Yes, now it's okay. Thank you.
Sorry about that. Can you tell us the name of the scientist who resigned and the 3 who removed their names, and if they gave reasons, what their reasoning was for their actions? And secondly, can you point to any new data or new analyses from the report? You mentioned that it's definitive that this was from December of 2019 in China, which suggests to me that you've ruled out the serology and viral evidence from other countries that China has pointed to, with China arguing that it did not begin in China. So that sounds like a definitive analysis. Is that correct? And are there other definitive analyses or data points that advance this?
Thank you, John. Dr. Van Kerkhove, please.
Hi, John. Thanks for the question. So when the report is released, you will see the names of the individuals of members who asked to be removed from the report. We respected their wishes. I just want to say that all 27 members contributed actively through the course of the last 3.5 years, and this is only a recent development, but you will see the names, and we just wanted to thank them and respect their wishes for asking their names to be removed because they didn't agree with the total report. And that's part of how these groups happen. As DG said in his remarks, not everything was agreed, and that's to be expected in science. So we respected those wishes. I'm going to ask Mariki to answer the second part of that question, but I did want to just caveat something in your question about definitive. I think right now, and what you will see in the report and what Mariki has said, is nothing is concrete, nothing is concluded with absolute certainty. And that's part of the problem that we have right now. Certainly on the earliest cases, there's a lot of information that suggests that there was circulation in December. How far back that goes, if it goes into November or even earlier, that's extremely difficult to be able to state. There was one large serosurvey that was done in Wuhan with 43,000 blood samples, and the results we were told is that all of the samples came back negative. We've asked for further serosurveys to be done in and around Wuhan with people who are working with animals, certainly animals that are susceptible to SARS-CoV-2. Again, this is an area in which we feel more work can be done. This is also, you remember, in December 2019, that was an active flu season. There are other circulating respiratory pathogens. Some of the earliest case definitions for COVID, you had to have a CT exam. People were very severe. And at the start of any outbreak, certainly at the start of a pandemic, you're going to miss the mild cases. And what we know now in terms of how the virus spreads and how people could have asymptomatic all the way through severe disease and death, you're certainly going to miss some early cases. We did follow up in a number of different countries where there were indications of positive samples in Italy and France and Spain, and there's a number of them. There's a table in the report, and we followed up on each and every one of those. Having said that, if there are labs in countries that have samples, clinical leftover samples or blood samples or serology, it's worthwhile to have a look. But that needs to be done strategically, because what the evidence does tell us is that there was low level of circulation then. So you have to have the right methods to do so, which is why global collaboration is important. But I think Mariki will probably want to add.
Dr. Venter, would you like to add something?
Yeah, sorry. I think Maria covered most. Sorry, I'm frozen. No, sorry. Maria covered most of what I would like to say as well. So although we say no cases circulated earlier, it really means that it did not circulate at a high enough level that we detected it. The serology from Wuhan was all negative, according to them. We know that the case definition initially in Wuhan was very strict, and that mild cases would have been missed that way. And so individual cases that we've looked at that were traced back to the 1st of December, for example, were actually mild and initially not recorded, but they were hospitalized later on. So we think that the severe cases, were detected there. Probably lots of mild cases may have been missed, but we don't see active circulation at a high scale in countries outside of China or outside of Wuhan that's been reported to date. Of course, it needs to be followed up, as all science. Maybe we will find something in the future, but at this stage, there doesn't seem to have been widespread cases or circulation of SARS-CoV-2 outside of Wuhan before or early in 2019. Thank you.
Thanks again. Thanks again. So let's move to next question. Carmen Paun from Politico. Carmen, please go ahead.
Thank you so much, Tarek. I just wanted to understand a bit more about what the disagreements were regarding the report. As you've already discussed, there's a lot of speculation about the origin of COVID-19, and I believe that whatever the disagreements were could also be easily be speculated one way or the other. So I was wondering if you could provide more information about why the three people who wanted to be taken off the report, if there's some parts that they didn't agree with, if there's some sort of like minority opinion that they drafted to kind of explain their position on that. And if I may, real quick, I saw that the WHO published an announcement about anti-obesity medicines based on semaglutide and the risk of a eye condition. And I was wondering if anyone could address that and say how significant that is and how concerned people who have been taking these medicines or are taking them should be about this. Thank you.
Thanks, Carmen. I think for your second question, really best is to send us an email, and we will find the expert in-house who can answer that one. So let's go back to the first one on SAGO. Dr. Van Kerkhove.
Yeah, I'm going to start with that one because for our normal procedures for advisory groups, we consider the deliberations in each of the meetings strictly confidential. And that is on purpose so that all of the members can have the discussions and the robust discussions that they want to have. Pretty sure you can imagine the kind of serious debates that would be done. When you look at the report, you will look at how rich it is in terms of all of the different content. You just look at the discourse in publications, you can see that there's many different views that people have. I think, frankly, the fact that, we cannot reach complete consensus is not necessarily a negative thing. This is showing that this is science, and science is incredibly hard. And especially when you don't have all information, the aim of SAGO was to have a fair, a factual, and an evidence-based report. To not be able to say exactly what happened, with the certainty that we would have liked, just shows how difficult it actually is after 3.5 years. But I do want to just say that the discussions, the deliberations are confidential amongst the SAGO members.
Thank you very much. And yes, again, Carmen, please send us an email on the other topic, and we will try to help. I think we have time for one more question. We have Laurent Sierra from a Swiss news agency. Laurent, please go ahead. Do we have a Laurent Sierra from a Swiss news agency with us?
Can you hear me now?
Yes, Laurent, we can hear you now. Please go ahead.
Sorry. So now we have a pandemic accord, even if we have to negotiate the PAPs. So a question on what might change in the future and the future work of the next SAGO, if the name will remain. What do you think that historic agreement might change in the condition for the work in similar cases in the future? Maybe both Dr. Venter and Dr. Tedros. Thank you.
Thank you, Laurent. So the question is on pandemic treaty and then the SAGO, and what's the combination there? So, Dr. Van Kerkhove.
Yeah, thank you. So the work of this advisory group will continue. It will have new terms of reference. Like I've said before, they've finished their first term, and actually in the context of what we've asked them to do, that work is complete. The terms of reference are being revised. Now, remember, SAGO was not set up only for SARS-CoV-2. It was set up to develop this global framework, and it was for the study of the emergence of novel pathogens or re-emerging pathogens. There are many pathogens that re-emerge. There will be new pathogens that will emerge, and it's to apply that global context each time. SAGO produced a report related to Mpox and looking at the re-emergence of Mpox, made recommendations on what studies need to be done. We anticipate that SAGO will be utilized for this focus of looking at the emergence of any known pathogen in a new location, for example, or any novel pathogens going forward. This is really, the global framework is really the first time all of this information and what studies need to be done, from environmental studies all the way through looking at audits in laboratories, put together in one framework. Elements always existed, but they were separate. So what we want are member states to be able to utilize this global framework going forward, and we expect the new SAGO will be able to look at how did this framework work, was it well, should it be revised, and to make it better for the next time. But we also anticipate SAGO to be advising on other pathogens with epidemic and pandemic potential.
Thank you very much, Dr. Van Kerkhove, and this brings us to an end of today's press briefing. As we have said, so the SAGO report will be online shortly, and we will send to our global media list press release that will contain the link to the report. As always, the opening remarks of Tedros will be posted, and we will have audio and video file as well sent to you in the next couple of hours. With this, I will give the floor to Dr. Tedros for his closing remarks, and I would like to thank also Dr. Venter for being with us today.
Thank you, Tariq. As some of you may know, today is Dr. Mike Ryan's last press conference with WHO. And over the past 5.5 years in particular, since the COVID-19 pandemic began, Mike has provided an authoritative source of information for the world's media. So you know that, it's not a news to you. And I know that many of you value his experience, his knowledge, and his Irish way of saying things. WHO will not be the same without Mike, and neither will our press conferences. But when he says, I'm tired and I need to go, it's very difficult to keep him. Mike, my brother, my general, my friend, thank you from all of us for everything you have contributed to the health of the world's people and to keeping the world's media informed. Maybe I'll try to say it in Irish. Gorai guvre ma agut. Is it correct? Gore mahagut means thank you, Mike. And we wish you every success, and you know that we will miss you, but we know also how to find you, so you cannot hide from us. But I would like also to invite you maybe to say thank you to the media, to the press. But from me, thank you for joining us today and really appreciate. And Mike, please.
Well, you caught me by surprise. It's rare that I'm speechless. So, no, I just thank you to all. It's been a long road, 8 years leading the emergencies program, and I can tell you it's a 24-hour, 365 job, and it's been a great honour, Tedros, to lead it on your behalf and on behalf of all of our wonderful staff and our partners, the people out there in the front lines, because we sit here in Geneva in the gilded cage, but those people who serve on the front lines of emergency response and the front line of public health intervention across all the agencies and across all the programs of the ministries of health, they're the real heroes of global health. And it's been an honour to serve them, an honour to serve you. The fourth estate is very important to me. You and the media are very important to me, and especially in a world that's so fragmented, your role is more important than ever, and I think the role of public health leadership is more important than ever. One needs to be courageous at times like this. It's easy to be brave when there's nothing at stake. It's hard to be courageous when everything's at stake, and I think we live in a world where a lot is at stake. Immunization is at stake, peace is at stake, health is at stake, honesty is at stake, the truth is at stake. So I think we have a common cause. We may bash up against each other from time to time. Your job is to keep us accountable on behalf of the people we serve. Our job is to enlighten you as to what the real issues are. And when I look around the table and see the people who are sitting here, especially you, Maria, who've enlightened the world, and Kate and Teresa and others, and many who've sat at this desk. It's been wonderful to watch people grow and people engage and do that. But just one point on what we said today. Someone did ask about, does this distract from WHO, SAGOs and all of that? The investigation of the origins and the investigation of what happened, the forensic understanding. We all do this in our lives. You know, we look back to see where did we make mistakes, where did it go wrong, and there's a huge positive aspect of that to help you move forward. And there's also a very negative aspect of that. If that's manipulated and if that's forced and that's done under pressure, it can cause dysfunction. So all of you out there, it's just in your normal lives, how much is enough? What we're looking for is improvement. If looking back and creating more tension, where we should move forward to create cooperation and participation and improvement. Many a relationship was saved by the ability to what would you call it, managed obscurity, where complete truth doesn't necessarily benefit a relationship. And I think that is the case between our member states. We've moved progressively in cooperation in the IHR revision of 2005 and into the IHR amendments revision under Tedros, the Pandemic Accord. We're actually learning better ways to cooperate globally on epidemics and on emergencies. Tedros mentioned the Pandemic Accord and he mentioned the Pandemic Fund and many other initiatives. So are we getting better at this? We are. Institutions like Gavi, institutions, the Medical Countermeasures Network, we're getting better. Are we perfect? No, we're not. We are getting better. But in this era of collapsed funding, of mistrust in public institutions, of the, in my view, the attacks that international UN and NGO organizations are under, this is not helping. But certainly we need to continue to look at origins and everything else. But if that's only been driven by political outcomes, if that's only been driven by the intent to hurt, if your intent to investigate is only to punish, you will never have justice. If your attempt to investigate is to be enlightened, then you will find justice through the process. And I think we continually have to find that balance in this. So yes, do we need to continue? Yes. Would I like to know what the origins of this virus are? Yes, because we want to be able to shut the door, close the trapdoor so that virus can never escape again. But there are many, many other viruses in the world. So that ability to be able to have the framework for investigating these, and it's not in the Pandemic Accord and it's not in the IHR amendments, but who knows? Maybe as time goes by in the next round of IHR amendments, the actual specific investigation of the origins will be enshrined in law. Right now, what we have is a framework. We have a framework that's been approved by our member states. That's enough to move forward. So with that, Tedros, thank you for your leadership, for your friendship. It's been a blast, to say the least, and your personal courage is always an inspiration to me, and this organisation could not be better led. Thank you.
Thank you again, Mike, and thank you also to members of the press for joining us today, and see you next time.